Welcome back to Healthy Living for Life. I would like to introduce our next guest, Dr. Wardell from Pureview Health Center. Doctor, welcome to our show.
Thank you, Sarah. It's an honor to be here.
So I'd like to talk about tooth implants first.
Sure.
How are they implanted and how long do they generally last?
Sure. So first, like in an area of like a missing or lost tooth, a dentist will implant a titanium surgical screw into the bone. Typically after that procedure, the area is let to heal for about 6 weeks to a month, and then a lab fabricated crown is attached to that surgical screw to replace the missing tooth. And that can be done with bridges and actually for retention of dentures as well. I think that as long as the home care and preventative maintenance are done on that implant, they can last up to a lifetime.
So I've been told that things that go on in a person's mouth can be a general indicator of health. Mm-hmm. So for example, indicator of osteoporosis or diabetes or even cardiovascular health. Can you talk about that? Is that really correct?
Yes, there's a very strong correlation between oral health and systemic conditions. And it's really important to maintain a good, healthy oral environment to prevent exacerbating, existing conditions or, causing other conditions. I'd say specifically what comes to mind is diabetes. Diabetes in general causes poor wound healing, as well as greater susceptibility to all kinds of infections. So that can relate to dental infections and oral health as well.
So what would a person or a patient look for?
So as far as like systemic issues, red swollen gums, white buildup around teeth, bleeding on brushing or flossing, loose or mobile teeth, I think those are some of the kind of classic signs of issues going on.
So what about dental X-rays? Can they help discover disorders or diseases?
Yeah, absolutely. The main thing with dental X-rays is to to find decay or cavities, but dental X-rays are an extremely important part of a dental exam in the fact that they can find abscessed or infected teeth, cancerous issues of bone disorders. We get a lot of concern as far as patients with X-rays and the amount of radiation. A majority of that is related to the old kind of film technologies. With kind of the digital technologies that we have today, the radiation is minimal. I'd say it's comparable to wearing, say, like a digital watch or even just taking a flight on a commercial airline. So it's really important that patients, when they come in, that those X-rays are taken and that we can see what's going on.
So anesthesia for dental procedures has come a long way.
Yes.
But what would you tell a patient that maybe had a really bad experience as a child or a young adult and they're very much afraid of going to their dentist?
Yeah, that's another, I'd say probably one of the main concerns that we have with patients that come in. Is there's a lot of dental phobia out there, and there is quite a lot of options and related to that. Kind of one of the first things that can be done is, kind of a desensitizing of the dental kind of environment, coming in, talking to the dentist, sitting in the chair, seeing some of the things that are being used, kind of explanations of those procedures. Along with that, there is, the potential for minimal sedation, like just taking a pill, something like Valium or something like that before the appointment, just to kind of alleviate that kind of fear, as well as, we use nitrous oxide, which is, laughing gas, and that's a very, very safe and effective way to kind of, reduce that stress. And the best part about that is at the end of the procedure, the patient leaves without any sort of after effects. They don't have to be chaperoned, and, they can function throughout the rest of the day like in a normal capacity.
I've heard that drinking too much can impact the health of one's mouth. Can you talk about that? How does that happen?
I think anything, more than moderation can, affect health. I mean, and a lot of the same things related to alcohol can be said for smoking and tobacco use as well, which we see a lot of. Drinking it specifically, can cause issues with dry mouth as well as systemic conditions, nutritional deficiencies. A lot of the drinks, alcoholic drinks, specifically like beers and wines, can be acidic, which can erode enamel away. And a lot of things in mixed drinks, some of the mixers and stuff are high in sugar content, which can cause a greater susceptibility to tooth decay.
Yeah. So what about new technologies? Are there some new things out there that our viewers would be interested in learning more about?
Yeah. So, obviously we kind of already touched on, the implant kind of options. A lot of the newer white-colored fillings or porcelain crowns can achieve a lot better, like aesthetic, result. However, I would say that a lot of the older technologies, the gold and some of the metal fillings that we have, are still some of the best, dental restorations that we have today. There are things like dental lasers, and there's always technology in dentistry. So, there are a lot of exciting things coming out.
And so teeth whitening and all of that is part of this as well.
Right. Yeah, teeth whitening, I think, is a very popular, kind of deal, and the technology keeps improving with that. And I think that, patients that are interested in that, besides going to the dental office, there are a lot of options, even over the counter, that are very effective in the tooth whitening realm as well.
Excellent. Well, I would like to thank all of our guests on today's show. I hope you learned how to improve your health. Until next week, stay fit, stay well, and stay healthy for life with Healthy Living for Life. Have a great week, everyone.
Healthy Living for Life is brought to you by Mountain Pacific Quality Health. We'd love to hear from you. If you have suggestions for future programs, visit our website at mpqhf.org or call us at 406-443-4020. You can also catch us on YouTube by visiting our website and clicking on the YouTube icon. Special thanks to Fire Tower Coffee House and Roasters. Production facilities provided by Video Express Productions.